Hi, my name is Meg Beal, a physician assistant here at Carolina Advanced Health, and I'm going to talk to you briefly today about the new cholesterol management guidelines. As you may have heard, the way in which we use statin medications to treat cholesterol is evolving. The latest compilation of research has led to the release of new guidelines related to when and how we use these cholesterol-lowering medicines. A changed approach. New recommendations have been released from the American College of Cardiology and the American Heart Association based on the latest compilation of extensive research. This research has shown that there's limited benefit in treating cholesterol levels to try to achieve a certain goal number for your LDL, or bad cholesterol, but rather using these medications regardless can provide significant benefit, like reducing the chances of a heart attack or stroke in patients who are known to be at higher risk of these problems. A brief cholesterol overview. Cholesterol is a fat-like substance that is produced in the liver. You may remember that the total cholesterol goal is under 200. Your LDL, or bad cholesterol, consists of the particles that stick to the walls of your blood vessels and raise your risk of having heart disease. Goals for this value have traditionally varied depending on any health conditions that you may have. HDL cholesterol is considered the good cholesterol and is essentially the cleanup crew that helps to prevent bad cholesterol from building up in your blood vessels. Triglycerides is the storage form of fat in your body, which is formed primarily from the breakdown of carbohydrates and processed sugars. These values all have a bearing on your risk of cardiovascular disease and can be affected not only by your lifestyle, but by your genes as well. Statin medications. While healthy lifestyle choices related to diet and physical activity remain the most important and effective way to manage cholesterol and reduce your cardiovascular risk, statin medicines are a great tool that we have as well. Statin medications are cholesterol-lowering drugs that affect how the liver metabolizes cholesterol. We have learned that statins offer benefits aside from just lowering cholesterol levels, like by stabilizing blood vessels, which reduces the chance of a plaque breaking off, causing a heart attack or stroke. These medicines can therefore prevent heart disease and stroke from occurring. A new direction. There's a new direction we are following regarding cholesterol management. Treatment is no longer focused on just LDL level, but is now based on certain cardiovascular disease states, and certain doses of statins are used based on their level of intensity. From many years of statin medication use, it's known that these higher intensity statins, such as Lipitor at higher doses and Crestor at higher doses, should lower your LDL value by about 50% or more from where that level was before treatment was begun. Likewise, more moderate intensity statin medicines like lower dose Lipitor, lower dose Crestor, simvastatin, and pravastatin are known to reduce LDL by about 30 to 50% from baseline levels. Knowing how much these medicines will lower cholesterol helps us in targeting their use. Treatment based on condition. These new guidelines recommend that we treat with certain statins based on known medical conditions for patients. Coronary artery disease, which includes patients who've had a heart attack, stroke, stent placement, or heart bypass surgery in the past, are recommended to have high-intensity statin therapy for those less than 75 years of age, and moderate-intensity statin therapy for those over 75 years of age. Patients with diabetes who are between the ages of 40 and 75 with an LDL of 70 to 189 and no diagnosis of coronary disease are recommended to have a moderate intensity or high intensity statin depending on their level of risk. Anyone in the population with an LDL over 190 is recommended to be on a high intensity statin, and anyone without coronary artery disease or diabetes who has an LDL of between 70 and 189 with high calculated risk should be on moderate or high intensity statin therapy. So this begs the question, how do you know what level of risk you have? There's been a risk calculator released with this new set of statin guidelines, and this takes into account things such as your gender, age, race, cholesterol, blood pressure, whether or not you take blood pressure medications, if you have diabetes, and if you smoke. For patients without coronary artery disease, your 10-year risk of having a heart attack or stroke is calculated using this formula. In summary, there has been strong research supporting using targeted statin therapy to help us prevent heart attack and stroke for those with a variety of known risk factors. This will help with patients who have had a heart attack or stroke in the past in preventing further episodes in the future, and for those who have never had a heart attack or stroke in preventing these things from occurring. I highly recommend you talk to your healthcare provider about your cholesterol and what these new guidelines mean for you and your health. Thank you.